Hello everybody! In today's video we will discuss with you the history of surgical operations. Surgical operations that require cutting and working inside a patient's body happen in the operating theatre. In this video, you see the area in London that used to be the site of one of the London's oldest hospitals, called St. Thomas's. St. Thomas's was here for almost 700 years and had one of the country's first ever operating theatres. Have you ever had an operation? If you have, it was probably in an operating theatre like these modern theatres. They are clean, spacious and bright. As you can see, they are full of high-tech equipment and they are designed to make surgery as clean and as safe as possible. They usually have an adjustable metal operating table in the theater in the center of the room. Above the table, there are several large fluorescent lights which allow surgeons to see everything at the head of the table. There is an anesthetic machine around the room. There are various monitors measuring the heart rate, blood pressure and blood oxygen levels. But what about an old operating theatres? What were they like? Well, St. Thomas's old operating theatre used to be in the attic of the church. The hospital was moved from here in the 1860s, but when a historian decided to investigate the church's old attic, they found a large abandoned room containing some old-fashioned surgical equipment. Today this room is a part of an old operating museum. The museum has been teaching visitors about the history of surgery for over 50 years. The first question many people ask when they come here is, why is it called an operating theatre? Well, the answer is simple. As you can see, medical students used to stand here and watch the surgery like an audience watching a play in the theatre. During the operations, the room was always cramped and crowded, and the bigger the audience and the bloodier the operation. Imagine how frightening it must have been for the poor patients, and they were usually victims of the audience watching. Rich had their operations at home, but the poor would tolerate the audience in order to receive surgery they would never be able to afford. There was no anesthetic, so patients were awake throughout the procedure, unless of course they fainted. The surgeons were quick, they could amputate a leg in less than a minute. They had a very little understanding of hygiene. There were no antiseptics and the surgeons always wore the same coats, which were usually covered with blood from previous operations. They often used dirty instruments, which were kept on this old wooden table, and they were rarely washed their hands. Below the operating table, there was a wooden box filled with sawdust or wood shavings. This collected the blood from each operation. In such unhygienic condition, it isn't surprising that patients often died during surgery. After the patient's death, their bones and organs were kept for further study. All of these practices seem primitive to us today, but without these techniques, we might never have developed the cleaner, safer procedures we have today. That's something we all can be grateful for.